you manage HCG exactly like how you manage testosterone. You still have to check labs. At the end of the day, it is still an exogenous product that you're injecting. But the difference is one is when you inject testosterone, it acts on the receptor right away, versus one has to go through what I call a middle step. And basically, since it mimics LH or luteinizing hormone, then it basically has to stimulate your own testicle to produce the testosterone. The minute you stop using the anabolic steroid, it's going to be very hard for you to keep it up, keep that muscle up, right? Because your body wasn't meant to have that much muscle. So no matter how hard you work out or whatnot, you're going to end up shrinking back down to what nature intended it. That's why I don't recommend using anabolic steroid. I really only recommend testosterone replacement if you have symptoms. Not all guys live at the same testosterone level. Well, there are guys that can live at a testosterone of 400 and be great, be productive, no issues with libido. But some guys, their testosterone levels just need to be around 600. So some guys, you may quote unquote be in the normal range, but it's not their range. So you're going to have guys that need to be in the 600 range. You're going to have guys that need to be in the 700 range.
Let us priceless, take it to the moon. Priceless, one day will be soon. What is priceless?
Hey everyone, welcome to another episode of D-Talk with Dr. Pham. Today I'm going to talk about testosterone management, treatment, as well as alternatives. And remember, I always have to give this disclaimer: don't self-diagnose. If you feel like you have symptoms of low testosterone or whatnot, seek your professional help from your healthcare provider and referral to a urologist if needed. And then also, please hit subscribe so that I know that people are watching it, enjoying it. And like I said, I'm doing this as a public service just because urology is not a very well-known topic. So let's get into it. So there's a lot of testosterone clinics all over the country, to be honest with you. In the last few years, I don't know how many thousands of testosterone clinics have popped up. And, and a lot of guys who do get testosterone, I'm not really sure if they fully understand the ramifications of testosterone and all that. So, basically in males, the normal testosterone range is very wide. It can be from 250 or 300 all the way up to 850 to 1,000, just depending on the lab that you use. And so normal is anywhere in between there. But you have to keep in mind that not every guy can live at the same testosterone level. Some guys may, for them, 400, they feel great. They're just awesome. And for some guys, 400, they're still, even though it's considered normal, they still have symptoms of testosterone deficiency, such as decreased libido, decrease sex drive, decrease energy, laziness, decrease, low self-esteem, low muscle mass, and all sorts. And it's just inevitable as a male, as you age, testosterone levels just go down. Now, what's interesting is that I think we are seeing more younger males now that are coming in with low testosterone. And, there's multiple factors, right? But one big factor is stress. Stress definitely can lower your testosterone level. And so today, I know I did an episode on testosterone before, but today I'm going to focus kind of on alternative. And because not every guy can tolerate testosterone replacement, whether it be they're getting acne, they're getting angry easily, what we refer to as roid rage, and quite frankly, a lot of guys are abusing testosterone for bodybuilding. And and I just don't condone that. And the reason being is your heart is supposed to match your body's physique. And so when you artificially stimulate your muscle from getting bigger, because remember, you don't make new muscle, right? the muscle fibers only become larger. And so when you work out, what it does is it tears your muscle. And then when your muscle rebuilds, it'll rebuild, bigger, whether you use testosterone or not. If you use testosterone, then basically it'll stimulate your muscle to build back even bigger. And then you also have the anabolic steroids, which is basically synthetic steroid I'm sorry, synthetic testosterone, which basically is 1,000 times stronger. And so and so they take this, and then they get their muscles all big and stuff. But yeah, what you have to keep in mind is that it puts a lot of strain on your heart, right? Because when you use testosterone for what it wasn't intended to be used for, which is to body build, what's going to happen is the heart's going to have to work harder to be able to pump all this blood into bigger muscles. And, the heart, if it does that all day long, eventually it's going to poof out, for lack of a better word. And so when you think about abusing steroids, just remember there's always a price to pay. Now, what I'm going to talk about is basically testosterone replacement and alternatives. And so, I'm not going to get into the details how testosterone is produced and all that. Everyone kind of already know that. You just do a quick Google search and it'll tell you exactly how testosterone gets produced and all that. And, a bulk of it is produced by your testicles. And so, lately I've been seeing guys who are on just testosterone replacement just because of stress or whatever it is. And so their levels are actually low. And so then, you just prescribe, 100 milligram a week, or, 200 milligram a week, depending on, how they respond. And especially if you're going to do injections, you have to kind of do a lot of lab work initially to kind of figure out what works, what doesn't work, and all that. And then the other important thing to remember about testosterone is that it does increase your red blood cell level, or hematocrit. And so you really want to keep your hematocrit below 45. Above 45, then you really should donate a unit of blood. If you have cancer or syphilis or anything that blood is not usable, then there's something called therapeutic phlebotomy. And I know some places charge you to draw that blood, and because it's but they're not going to be able to use it. So and I had a patient that went to a place, and I think they charged him like $300 for a therapeutic phlebotomy. So I do know that Gulf Coast, yeah, your physician just needs to give them an order to, donate 1 packed unit of red blood cells. And the reason why is because you're on testosterone replacement. And just from my understanding, I think it's free. Or if they do charge you, it's probably very minimum, probably $5 or something like that. So just remember that if you have blood that is not usable, such as if you had cancer and stuff like that. And so that's just a side tip. So this topic is going to be a little bit different on my other talk when I spoke about testosterone, because in this one, I like to focus on human chorionic gonadotropin, or HCG. Now, when we think of HCG, we tend to think of it like fertility in females, like for IVF, or even not for IVF. But males do produce a very low level of HCG, very little, sometimes even undetectable. And so basically, HCG acts like LH. Okay. But before we can understand all that, let me kind of just give you just basic anatomy on how testosterone gets made and all that. So basically, you have your hypothalamus, which is in your brain, and the hypothalamus will then release GnRH, gonadotrophin releasing hormone. And what that does is it will then cause the pituitary. So it's like a downhill, it'll cause your pituitary. I don't know why this keeps coming up. So the GnRH will then stimulate your pituitary to release something called LH. And then what LH will do is it will stimulate something called the Leydig cells. And the Leydig cells is what will stimulate testosterone from forming. And then, probably misspelled that. But then basically your, and then it'll stimulate, spermatogenesis and all that. But the testosterone also has effects on, your muscle growth, kind of like what anabolic steroid does, except at a natural level. And so if you use exogenous testosterone, what it does is it'll feed back to the hypothalamus or to your pituitary area to let it know, like, it's kind of both actually, but to let it know, like, hey, the body has enough testosterone, so we don't need any more testosterone. And so that's how the body kind of regulates the amount of testosterone that you have. And then let's say you have stress or whatever that can cause your testosterone levels to go down, then the cycle starts over again. And so traditionally, the cheapest way to kind of body build and increase your libido, energy, and everything else that's associated with benefits of testosterone is given by injections, and it's cheap. And so guys like that. But there's an alternative, which I like better, which is ACG. So what ACG is, let's write it here. So ACG. So ACG actually mimics LH. And so by doing that, you don't get your testicular shrinkage, because remember, when guys are on testosterone, there's two things that can happen. One is you can get breast enlargement. So that's why you want to, you want to also check estradiol levels, so that if it is high, then you need to put like some sort of estrogen blocker, like a anastrozole or something, so that you don't end up having, breasts. Because once you form breasts, it really can't regress. You really need to have plastic surgery or someone reduce it. But it will also cause your testicle to shrink, right? Because it's no longer getting the stimulation from the hypothalamus and then the pituitary to release LH to basically stimulate your testicle to increase the testosterone. And so over time, your testicle would just shrink. And so that's why you'll see guys, when they get treated, the right way to treat it should be testosterone plus HCG. Because if you want to wean a patient off of testosterone, HCG is how you do it. And HCG, unlike testosterone, you don't need to give it intramuscular. You can just get it in, put it in the subcutaneous fat. And the units vary. I typically like 500 units either once or twice a week. The downside to ACG really is the cost. And a lot of insurance don't like to cover ACG. They'll cover testosterone, which is like $15 a month if you have insurance. If you don't have insurance, it's probably around, I don't know, $50 a month. Versus HCG, if you're going to do 500 units a month, 500 unit once a week, then, you're probably going to spend like probably a couple $100. And keep in mind that ACG, just because of the instability, you really can't compound it. And so that's kind of the downside. Unlike a lot of stuff like Ozempic, Wegovy, all these weight loss stuff, you can actually compound it. That's why a lot of patients are able to afford it, is because it's being compounded and not, they're not buying the name brand. So HCG, on the other hand, you really can't compound it, and that's why the cost is up there. But ACG really has a lot of benefits. The biggest benefit is that it acts like LH. And so even though you will get increased testosterone, you're not really shutting down your system in a sense that if you use exogenous testosterone or anabolic steroid, then that testosterone that gets produced is going to shut down your normal system. So that's why your testicles shrink because it no longer has LH or luteinizing hormone to promote the growth. And so, but by having ACG, then ACG mimics LH or luteinizing hormone. And so it's constantly stimulating your testicle to make testosterone as well as to keep it, growing. And there are studies that shows that ACG actually can be used as a monotherapy. And the only real downside to it is the cost. But if you can afford it, it's just a much better way to go because, for instance, if you use testosterone and you shut down your natural system, and now let's say you want to start a family, it's going to be tough because now you have to try to reverse course. And sometimes you may not even be able to reverse course if your testicle is so shrunken that you try to put them on ACG and you can't get the testicle to start producing the sperm and stuff. And so just remember that, like, if you already had a family and you don't plan on having any more kids and you really don't care that your testicle is shrinking, then you can use testosterone as a monotherapy. But really, but if you are young and you're still not sure if you truly don't want children or whatnot, then I honestly I recommend ACG. I do know it's pricier, but it doesn't shut down your natural system because it acts just like LH. And LH is what's going to stimulate the latex cells, which is what's going to stimulate testosterone from forming. And so, and then of course, ACG, you inject it with like those diabetic needles. I mean, because you really just need to get into your sub Q. It's very easy. And for patients that want to be weaned off of testosterone, pretty much that's what we use is ACG to stimulate it. And ACG usually comes in a vial that you barely can even see it, and then you have to mix it with sterile saline or sterile water in order to and your pharmacist will mix it for you so that depending on how many units your physician want you to be on. So sometimes for fertility, I'll even go as high as like 1,000 units a week or 1,500 units a week if they've been on testosterone for so long and now they literally produce zero sperm. And so that's kind of the benefit of ACG because we talk a lot about testosterone, but we don't talk a lot about ACG. And I think that's disappointing because testosterone, yes, it is cheaper, but like the old saying goes, right? You get what you pay for. ACG is just a much better alternative because it acts like your natural system, which is the luteinizing hormone, to stimulate your testicles so you don't get testicular shrinkage. You get the same effect, right? Because it's actually stimulating your testicle to produce testosterone. Now, is it going to produce enough testosterone to match the anabolic steroids? Well, the answer is probably no, because the anabolic steroids is synthetic and it's 1,000 times stronger than your regular testosterone. And so if you use a synthetic steroid, you just have to be careful about the long term. Because I had a friend that a while back, real healthy guy, but obviously you could tell that he's been on steroid because he's like he was just too big for his frame. And he ended up, which is unfortunate. He's okay, but his ejection fraction was like 25% or something. And that's ejection fraction from your heart. So, and that's because the muscle, I mean, his heart had to work all these years to pump blood to all of these muscles that nature never intended for the body frame to handle that type of muscle mass. That's why you see all these bodybuilders. In the long run, they end up with all sorts of issues: back problem, heart problem, and so just be careful when you do testosterone replacement. Now that's not to knock on testosterone as a monotherapy because the majority of testosterone replacement is just testosterone monotherapy, and then a estrogen blocker. When the estradiol level goes above a certain amount, so you don't form breast. But a lot of them opt not to add ACG to it because for whatever reason, cost, mainly it's cost. But especially if you don't have kids already, or you're planning on having kids, or you just don't want your testicle to shrink, then ACG is definitely the better way to go. And it used to be that you could compound ACG, but I think the issue is, the protein or whatever it is, it just wasn't stable. And so that's the reason why they're not able to compound it anymore. But before they were able to compound it, then obviously it'll be cheaper. But now, unfortunately, you kind of have to just buy it or the pharmacists kind of have to buy it from the manufacturer. So the price difference is going to be, quite a bit. But you really can't put a price on health, right? And so, and it's also, smoother in my experience from the patients that I treat, is when they're on ACG, usually after about a week or two, they start feeling normal again. But rarely do I ever see them get like roid rage. And I don't know, is it because the feedback loop is still kind of working, or is it because it's not increasing your testosterone level like that? Basically, because when you inject exogenous steroid, the steroid is already in your bloodstream and already working, versus ACG has to literally stimulate the testicle to produce the testosterone. And so I wonder if it's a smoother transition versus getting an injection. Then you feel good, faster, but you're also going to have a bigger drop. And so that's my take on ACG, and why I think, when you start testosterone replacement, whoever your urologist is, I would discuss with your urologist, hey, or your endocrinologist. Some endocrinologists will manage the testosterone replacement. I would ask them, what's your thoughts on ACG? Because, using it with the testosterone, just to keep your natural system going. Because it could be that you have a new job, or recently went through a divorce. The stress caused the testosterone levels to go down, but that's just a temporary thing. And so, it may be worth just doing ACG only, so that when you wean off, it'll be much easier, versus if you just go straight to testosterone, where, every week you inject X amount, then you're going to pay the price later. And so, now, can you overdo ACG? Absolutely. So you manage ACG exactly like how you manage testosterone. You still have to check labs. You still have to make sure, your blood count is not, your hematocrit is not above 45. You still have to do kind of the similar thing, because at the end of the day, it is still an exogenous product that you're injecting. But the difference is, one is when you inject testosterone, it acts on the receptor right away, versus one has to go through what I call a middle step. And basically, since it mimics LH, or luteinizing hormone, then it basically has to stimulate your own testicle to produce the testosterone. And like I said, patients that I manage with ACG, when I ask them, how they feel, they're like, it just, especially the ones that have been on testosterone, and for whatever reason, they're getting rages or whatever, and they want to try to not get that, then I transition them to HCG slowly. And sometimes it can take a year before I can fully transition you to HCG and get you off of the anabolic steroids or exogenous testosterone. And so, and like I said, with the insurance, for some reason, well, we know why. It's just because of the cost. No matter what I put in my note, they're like, well, too bad, because testosterone with insurance is probably like $15. I've never gotten insurance to cover HCG, and so I don't know what the cost would be for a month's supply of HCG. But I do know that the pharmacy that we use, they charge, I want to say it's around $500 for a 3-month supply of 500 units a week or something along that line. So it's not terribly expensive, but it's just much better, I think. And then, like I said, there are data to support using HCG as a monotherapy versus using testosterone as a monotherapy. And keep in mind that when I'm talking about testosterone monotherapy and HCG monotherapy, I'm not referring to the ones that abuse the steroids, because that's a whole different category, right? You're talking about using synthetic. You can think of it like synthetic steroid. That's 1,000 times or 5,000 times stronger than your normal whatnot. But just bear in mind that the minute you stop using the anabolic steroid, it's going to be very hard for you to keep it up, keep that muscle up, right? Because your body wasn't meant to have that much muscle. So no matter how hard you work out or whatnot, you're going to end up shrinking back down to what nature intended it. And so that's why I don't recommend using anabolic steroid. I really only recommend testosterone replacement if you have symptoms. And keep in mind that, not all guys, and that's why there's a big range, right? Not all guys live at the same testosterone level. So, it's still kind of controversial, but for me, when I think of it, what I'm thinking is, well, there are guys that can live at a testosterone of 400 and be great, be productive, no issues with libido. And keep in mind, testosterone has nothing to do with erections, okay? Erections is a totally different topic. But in order to start erection, you got to have libido. So you got to have an initiator. And so, but some guys, their testosterone levels just need to be around 600. So some guys, you may quote unquote be in the normal range, but it's not their range. So you're going to have guys that need to be in the 600 range. You're going to have guys that need to be in the 700 range. And so, and a lot of guys, they may have to be on testosterone or HCG for life just because they have to live at a certain level. But there are guys that, were abusing anabolic steroid, and now they don't want to use the anabolic steroid anymore. And so now I'm trying to wean them off to get them back to the natural state. And some of them can be very difficult because it depends on how long you've been using the anabolic steroid and kind of all that. And then there's also psychosocial issues, right? Because you're used to having this image of this big, muscular guy. And then once you stop the anabolic steroid, you'll notice probably in a month or two, you're like looking in the mirror and you're like, wow. My clothes fit loosely. I'm just, they're not happy. And so then they go back on the anabolic steroid just because they're used to being like big and all this. And so, so just be careful is what I'm getting at. And I'll leave with this, I think we live, we live in uncharted territory now, where looks is everything. And so I'm seeing more and more people get stressed because they don't look a certain way or whatnot, and then that then decreases their testosterone level, and then they end up going on testosterone replacement, and then they start to feel good again, and then they go into the gym, and then they get the benefit of getting the bigger muscle, and then from there they step over to the anabolic side, which is what I don't recommend. And then you go down this vicious cycle. And so just be careful is all I'm saying. And when you're getting treated, just make sure you talk to your doctor about, HCG, and is that an appropriate addition to the testosterone, because or even using it as a monotherapy. All right. So I hope that was very helpful. There was a viewer that asked, like what's the difference between kind of HCG and testosterone replacement, because he's reading online, surprise, surprise, right? He's reading Google and like it's all confusing and all that. So I said, well, let me just do an episode to kind of straighten, no pun intended, but kind of straighten this thing out, if you know what I mean. And so I hope that was helpful. Okay. So, like I said, if you feel like you have any symptoms or anything like that, don't self-diagnose and self-treat. Go get professional opinions. And if you're going to get testosterone replacement, make sure you get it managed by a reputable place or a reputable physician. And, and then kind of be responsible for your health, because if you're not, then no one will. And so I'll leave you with that. And then last but not least, please make sure to subscribe so that I know that people are listening and would like to continue for me to talk about whatever topic that they're interested in. Okay? All right. This is Dr. Pham signing off.
Let it's priceless. Take it to the moon. Priceless. One day will be soon. Let it's priceless.